Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about how when you have tick-borne illness and mold illness, oftentimes one of the things that gets affected is your ability to thermoregulate. Thermoregulation is a way that your body maintains its internal body temperature at around 98.6. It can vary, I would say, from 98.0 to 98.9. Once you get to 99 degrees, it's considered a low-grade fever. So there is a little bit of wiggle room, but not that much. The body is very, very capable of maintaining a very narrow range of thermoregulation. And this is because this is the temperature that the body's organs and biochemical reactions are optimally functioning. So it's really important, and it gets severely affected in tick-borne illness and mold illness and COVID as well. And one of the ways that you know that thermoregulation is off is people will come in and they have Raynaud's and their fingers are red. The tips of their fingers and toes are red and they're ice cold. So when you touch them, they're ice cold. That's the first indication that there's a problem with thermoregulation. The other thing is you can ask the patient, are you cold all the time? Do you have a difficult time warming up? And generally, a patient who is affected by tick-borne illness affecting thermoregulation will say yes. Thermoregulation is maintained by the hypothalamus, which is a master endocrine gland in your brain, and by the vagus nerve, cranial nerve 11. Now, you know the cranial nerve 11 is super important. It's the vagus nerve. It innervates all of your organs on the ventral side, on the front side of your body. It's super important. When that nerve gets inflamed, you get dysautonomia, you get an inability to properly thermoregulate, you get heart palpitations, you get GI upset. It is such an important nerve, and it's very important in thermoregulation. So one of the things you can do for thermoregulation is obviously dress warm. Wear a sweater, wear a jacket over it, and also take a warm Epsom salt bath a couple of times a day, like for 20 to 30 minutes. That will also help regulate. The other thing is to wear very warm socks to bed and during the day, and to wear very warm boots or shoes. And I mean really warm. They're fleece so that there's fleece on the inside. This is what I do every day. From basically November until end of April, I wear very, very warm shoes so that my feet never get cold. And I take really good care of making sure that I don't get too cold. When you get cold, your organs don't function optimally and your blood doesn't flow optimally. So it's generally not a good idea to get yourself really cold. One of the things you can do is you can get a vagus nerve stimulator. It's called a TVNS stimulator. Tom, Victor, Nancy, Sue stimulator. And you can use that. That will help re-regulate the nervous system and to just try and keep your body warm the best that you can. It's really important. You can get a really fleece-lined jacket like this. This is fleece outside and inside, and I have a sweater on underneath, and it's 34 degrees here. So I take a great deal of care in making sure that I stay very warm in the winter. The other thing that I do is I drink a lot of warm fluids, warm water and warm tea, and I drink it all day long. So it keeps the inside of my body very, very warm. And that way your organs and your blood flow work optimally. So I hope this information has been helpful to you, and I hope you have a wonderful day. Take care.